so we know that the President will be speaking at 8 o'clock tonight with COVID infections sharply on the rise and officially the country in a third wave. It is widely expected there will be more restrictions. There are, of course, great concerns about what is happening in our hospitals at the moment. So let's get in a sense what is happening in some of the private hospitals in South Africa. And I'm joined now by Dr. Kim Faure, Clinical Performance Manager for private hospital group Mediclinic, Southern Africa. Dr. Faure, thank you so much for your time. So you operate about 48 hospitals, I think, around the country. Could you tell us if any of your hospitals currently are having to divert patients?
Good evening, Sally, and to the viewers. The situation at the moment is quite concerning, especially with our current third wave, and we can see that the capacity constraints are occurring in some of our facilities, specifically in the Free State province, in Northern Cape and in Gauteng. And other provinces are not experiencing as much of an increase in admissions at the moment. The situation is fluid, however, and our hospitals remain able to see emergency and medical admissions. The patients that are seeking care are going to be screened at emergency centres, and then they'll be channeled according to their symptoms into a COVID or non-COVID treatment area. And we are making sure that all our admissions are triaged to make sure we prioritise those individuals that are requiring the significant amount of care. I think it's also important to note that whilst our ICU and our high care facilities are under tremendous pressure in some regions, not all COVID patients require ICU care or mechanical ventilation. So many patients can be admitted and treated very successfully with supplemental oxygen and other supportive treatment options. And Mediclinic has the capacity in its medical ward to be able to assist these patients in this manner at the moment.
All right. So, Dr. Faure, we have seen very disturbing reports, SMSs and WhatsApps going around, tweets, people saying you simply cannot get into a private hospital in Gauteng or in Johannesburg. Will you say that is certainly not the case for your hospitals?
All patients should go to the emergency centre, and as I said, they will be able to get emergency medical treatment in our emergency centres. They will be triaged, so we will determine their priority based on their medical condition, and they will receive the necessary treatment wherever possible in our facilities.
Right. So hospitals on divert, no.
Hospitals can be on divert for various reasons. It's not just that might be an ICU issue, that might be a very fluid and a short capacity and time issue. But as I said, the emergency centres are always able to see emergency patients.
All right, so hospitals are not on divert for COVID at all? None of your hospitals at this stage? I'm just wanting clarity, sorry.
I can't confirm or deny that at the moment.
How do you not know?
I don't have sight of that information right now, sorry.
Okay, all right. So you're not able to tell us if any of your clinics are currently on divert due to COVID-19. Why can't you tell us? Surely that's exactly why you're on the show.
So as I mentioned, I said our ICU beds and our high care beds can be under tremendous capacity constraints at the moment. So hospitals might be on divert for a very short period of time in order to alleviate their capacity constraints. But in terms of emergency treatment and care, our emergency care centres are all seeing patients.
All right, so what I'm hearing from you is that some of your hospitals are almost certainly having to make quick plan Bs in certain situations, and that it's quite fluid. Am I understanding this correctly?
Absolutely. So the fluid situation could be that the ICU is under capacity constraints, but as I mentioned, the emergency centres will always see emergency patients, and the medical wards still have capacity to admit patients in if those are the ones that don't need ICU care specifically.
We know that in the build-up to 8 o'clock tonight, there's going to be a huge amount of speculation on what the President's likely to say. I have spoken to quite a few medical experts who are already saying, look, we've got to start restricting the size of gatherings, for example. I know when it comes to hospitals, if you restrict curfew and the sale of alcohol, it has an almost immediate impact on how many people end up in the emergency wards for alcohol-related injuries, be it domestic violence or drunk driving. Is it possible to say whether your hospitals are under significant pressure that you might welcome some sort of relief of pressure in terms of perhaps some sort of restriction on alcohol tonight?
Yes, so in the previous waves with the alcohol bans, we can confirm that we haven't seen a significant change in our alcohol-related admissions to our clinics and our medical facilities. So the impact hasn't been as significant on the Mediclinic hospitals. We're obviously just talking from our point of view at the moment.
I see. So you've been sort of able to manage even when alcohol was sold. So is it something you don't have a particular view on either way?
We don't have a particular view on it at the moment at all, yes.
So you have said that your hospitals are under quite a lot of pressure. We also know that certainly in Gauteng, speaking to Bruce Malado, who does modelling for the province, that they're only expecting the peak to be reached in July. Projecting forward, what are you saying as a Mediclinic team in terms of whether you're going to be able to cope, and are you able to ramp up, bring in extra beds, make plan Bs? What are the sort of discussions you're having around reaching the peak still in 3 weeks' time or so?
Yes, so I think we can say that we are reaching surge capacities for the third wave, definitely in the Free State and in Gauteng and Northern Cape. But that doesn't mean that we aren't able to adjust our resources, make sure that we can get the staff or additional ventilators to the hospitals that are experiencing surges, because you'll find that surges happen differently in different parts, even in Gauteng itself. Every hospital is not experiencing the same capacity constraints. We focus a lot on making sure that our community is able to receive the support they require. So we focus on making sure that our staff are able to be skilled, to be able to move into areas where additional capacity is required. We're monitoring our oxygen consumption and our oxygen availability on a regular basis, and making sure that the resources from an equipment and a ventilator point of view is at the places where they are needed the most.
All right, so you watch where staff are needed, you watch oxygen supply. Have you had to do any rearranging so far?
It's a fluid situation all the time. We've got different hospitals hitting sudden volume increases at different times. So different weekends or last weekend and this week is very different from one hospital to another. So we're constantly following the hospitals. We're constantly evaluating their need for additional capacity and resources, and we're shifting and adjusting as we need to adjust with them.
Right. So I understand, obviously, it's a fluid situation and you guys have to be quite agile. When you say pressured, I just want to try and get a sense of how tough it is for the hospital group. I know that you're obviously making every effort to look after all your patients, but just how pressured is it?
I think the strain is significant on staff. They've been at this for over a year, and I think the second wave was a significant strain, and from a mental and psychological point of view. We spend a lot of time making sure that our staff have the necessary resources, both from a wellness and from a physical and emotional point of view, to be able to do their job and to provide the necessary care and compassion that they need to give to their patients that they are seeing. So it is an ongoing challenge, and I think everybody in the healthcare sector can all say that they're taking strain. Even those in management and senior leadership positions feel the pressure and the strain as well.